In today's video, I will be discussing with you how the stomach works and why we actually need stomach acid to reduce acid reflux. If that sounds a little backwards, please stick with me and watch the rest of this video. If we are meeting for the first time, my name is Dan Zatarski. I have been an independent pharmacy owner for over 19 years. I am the owner of MD Custom RX with my wife Monica and my father-in-law John. At the end of today's video, if you stick with me, I will be sharing with you two supplements that I personally have used over the last 20 years of suffering with acid reflux myself that I have found to be very helpful in, again, helping to reduce symptoms of acid reflux. I have used these in many patients that I have counseled over the years and found them to be very successful. Let's get into today's video. This is kind of one of those other take-home points. So when you eat a meal and it dumps into your stomach, there's a whole cascade of different enzymes and things like that get triggered. When stomach acid production increases, that sends a signal to the brain, which then sends a signal back down to this LES, this lower esophageal sphincter, to close and tighten up. So if you're on an acid blocker, you take a Prevacid right before your meal, or even whenever, honestly, if you're just on it daily, there's always going to be some of that drug floating around in your body. You're not going to produce the stomach acid to digest that meal. So if you're not producing stomach acid to digest that meal, the signal's never sent to the brain and back down to close the door. So your door's always open. Of course you're going to have acid reflux all the time. Now these drugs are so powerful that they block all the acid, or just about damn near all of it. And so there's such a little amount that you feel better and you don't have your acid reflux symptoms. But your door's always open. So then when you skip a dose, all of the pumps actually get turned on, and that's when it really hurts. And you're like, oh my God, I must be producing too much stomach acid. I need to go back on my antacid. When in fact, what you need to probably do is actually produce more stomach acid to get this door closed tighter. Now this door has a tendency to open and close just naturally on its own. But when we eat a meal, that thing needs to be clamped pretty darn tight, almost all the way shut. So, the interesting thing about this drug class that we'll get into is that they reduce the body's ability to absorb iron, and they reduce the body's ability to absorb magnesium. The problem with that, one of the many, is when you go on a proton pump inhibitor and your magnesium level goes down, that causes this door to close. And so now you've taken a drug that causes this door to open when it shouldn't be, and this door to close when it needs to be open. You've just switched the in and the out. That's a problem. So this pyloric sphincter, this gatekeeper, that's a magnesium dependent door. And so now you've just taken a drug to set yourself up to keep this door closed. So now it has nowhere to go but up. You're constantly stuck on these antacids. You can see how this drug class just drives me crazy. It's just totally messed up. Now I'm not saying if you have an ulcer here and you're bleeding in your stomach, that's a different story. Then you need to be on an antacid to block the acid to heal your stomach lining. But for the majority of the patients out there, if you don't have an ulcer in your stomach, you really don't need this medication. In my opinion. Talk to your doctor. That infuriates me. All right. Okay. Good. I'm not the only one okay. Yeah. Drives me nuts. Stomach acid cascade. So food enters the stomach. I think I just said all this. I'll just read it though. Causing stretching, which in turn causes gastrin secretion to begin. Gastrin turns on hydrochloric acid production, so it increases in acid production. The acid release stimulates histamine release, causing more acid production and more acid release. That's what this picture shows. There's multiple cascades to ramp up acid production for a reason, to digest our food and to help sterilize our food to a point. We don't eat sterile food. We all know that. We shouldn't eat sterile food. But it helps to kill some of the bacteria and viruses and parasites and whatever else might be floating around in our food. And that's a good thing. That's why you have an acid bath right here to help clean up some of the garbage in your food. So, and And if you start blocking that, which this is just a picture of, like, imagine all these pumps just lining on the inside of your stomach, waiting for food to come down to dump acid in to start digestion. These pumps literally get blocked. Here's proton pump inhibitors. They come in and they block this acid pump really, really well. If you are suffering from acid reflux, I strongly encourage you to have your doctor or provider test the pH of your stomach. Let me say that one more time. If you suffer from acid reflux and you're taking an acid blocker, I encourage you to have your physician test the pH of your stomach. There is a test out there called the Heidelberg test that we can use to actually test to see if you're overproducing stomach acid. As I promised at the beginning of this video, I want to share with you 2 supplements that I personally have used over the years that I have found to be very beneficial in helping to reduce symptoms of acid reflux and GERD. The first one is something called GlutaShield. GlutaShield is a product made by Orthomolecular here in Wisconsin, up in Stevens Point. This product has over 6 different ingredients to help establish and basically maintain a healthy GI tract. The second product that I would encourage you to look at and discuss with your physician or schedule a consultation with myself is something called betaine HCl plus pepsin. Betaine HCl and pepsin is really nothing more than stomach acid with an enzyme, pepsin, which helps to produce even more stomach acid. And you would think that's counterintuitive. We're trying to reduce acid in the stomach, but really, in fact, what we're trying to do is close the door to the stomach. What we're trying to do with betaine HCl and pepsin is to actually close that door, which you just learned about, called the LES, the lower esophageal sphincter. So those are my 2 products, GlutaShield and betaine HCl with pepsin. If you found value in today's video, I encourage you to give this video a thumbs up. And if you know of somebody out there that is suffering with acid reflux, I encourage you to share this video as well. Until next time, have a great day. In next week's video, I will be discussing the many pitfalls of proton pump inhibitors, known as PPIs. And that is it for today. Thank you.